When performing a preoperative assessment, you're going to start by going to the patient's room or wherever you're doing the assessment at. Knock on the door. You're going to introduce yourself. You're going to identify your patient by 2 identifiers, name and date of birth. Then you're going to explain what you're doing and that you're just going to start a pre-op assessment. You're going to wash your hands, gather all the equipment you need. And then you're gonna confirm that the patient understands the surgery and the anesthesia. And when you're doing all of this, you're gonna, at that time, you would understand the patient's like emotional status at that point. You're gonna ask them if they have any kind of advanced directives. And then you're gonna collect a full history, including things like allergies, previous surgeries, family histories, medications, does a patient smoke, any kind of implants or prosthesis, and even their occupation. So their full, complete history. And then you're going to check with the caregiver to ensure that that is all complete as well if the patient's not able to give you all that information. After doing that, you're going to do a full head-to-toe assessment. So you'll have your physical part of your H&P. You're going to start with a neurological assessment. Some of that would have already been done when you identified your patient. And then you're going to do lungs and respiratory status. So you're going to listen to lung sounds in all the fields. You're going to listen to apical pulses, feel radial pulses, pedal pulses to check circulation. You're going to do the GI part of your head to toe. You're going to listen and palpate the abdomen. You're also going to check when the last time the patient ate or drank anything was. Then you're going to do your musculoskeletal system, checking like strength and reflexes. That way you can assess for the risk for a post-op clot. You're also going to do a skin assessment to make sure that there's no openings that are at risk for infection. You're going to review all the patient's labs, and you're going to report any risks that you found in your H&P or your head-to-toe to the pre-op team. You're going to then give instruction to the patient and the caregiver, instructions like when the schedule is, when they should be there, and make sure that they understand that. You're going to make sure that all of your information from your H&P and your head to toe is all complete, and verify any kind of unclear information with the caregiver if the patient can't verify it. You're going to evaluate the patient's ability to cooperate. So you're going to make sure that they understood all of the information you gave them, all the education and the teaching that you gave them. Make sure that they understand the schedule and like the amount of time they can't eat, and make sure they understand the anesthesia. After you tell them all of that, you're going to have the patient repeat any of that information to you, just so you can verify that they understand why you gave them all that information and that they actually listened to all the information. You're going to document all of your preoperative notes. So any kind of notes you got from your full assessment, you're going to document those. Then you're going to report abnormal labs or concerns to the surgeon and the anesthesiologist. And then you're going to document the evaluation of the patient's learning as well. So not only your notes, but you're going to also document that the patient did understand the teaching that you gave him. And then that's it for your pre-op assessment.